Good evening, everyone. Just wanted to check my audio. Can everyone hear me?
Yes.
Yes, perfect. Thank you.
Yeah.
So it is 6:30. We'll have a few individuals hopefully joining us, but good evening, everyone. And welcome to this evening's FSHP presentation.
Yes.
If you can, for those of you on the call, if you can please mute your audio. Thank you. So again, good evening, everyone, and welcome to this evening's FSHP presentation. My name is Claudia Lopez, Population Health and Transitions of Care Manager for the Memorial Healthcare System. With me today is my co-host, Kelly Ruby, the Clinical Ambulatory Specialist for Baptist Health. We are very excited for today's presentation by Dr. Murad Hesham on the topic of artificial intelligence, brought to you by FSHP's Ambulatory Care Forum. Now for just some general FSHP announcements, we invite you to connect, collaborate, and elevate our ambulatory practice in Florida by signing up for the Ambulatory Care Forum. It's a great space for pharmacists to network, share best practices, and discuss ambulatory care topics. Here is the QR code, which will take you directly to the site listed here. We hope you consider becoming part of the forum. Additionally, we remind everyone that FSHP's 59th annual meeting is this August 8th through 10th at the Orlando World Center Marriott in Orlando, Florida. We invite you to join us for this year's theme, Elevate. The Ambulatory Care Clinical Forum will be having a networking reception at the meeting. This is a great opportunity to meet in person, collaborate, and network with folks in the field of ambulatory care, including primary care, transitions of care, community pharmacy, population health, or specialty pharmacy. We hope you come join us for some yummy food and participate in some fun games with us. This event is sponsored by Bayer Healthcare. The information for the RSVP is here. Limited space is provided, and you can RSVP to Robin Hicks and or Araki Patel from Lee Health. Finally, just some instructions for the CE this evening. Following the webinar, attendees will receive a link to claim credits and evaluate the presentation. This link will be sent to the email address that was used to register in Zoom. It will come from Tamikia Bennett. The link for the evaluation will be active until July 25th at noon, so please complete the evaluation by that deadline. You can contact Tamikia Bennett if you do not receive a link to the evaluation within 24 hours following the webinar. Also, please remember to check your junk and spam folders. So now, without further ado, please join us in welcoming Dr. Hesham Murad, Senior Pharmacy Manager for Acute and Ambulatory Care at the Mayo Clinic and Assistant Professor at the Mayo Clinic College of Medicine and Science. Dr. Murad brings a wealth of experience in clinical pharmacy, informatics, and leadership. He holds a PharmD from Purdue University, completed a PGY1 and PGY2 residencies in pharmacy practice and informatics, and is board certified in pharmacotherapy and critical care. He is also pursuing a master's in artificial intelligence and healthcare, reflecting his passion for advancing patient care through technology innovation. A great speaker today for this topic. So I turn it over to you, Dr. Murad.
Thank you, Claudia. Thank you to FSHP and the Ambulatory Care Clinical Forum for having me for this presentation. Looking forward for this exciting hour to chat with you guys about what's the augmented intelligence in ambulatory care and what's the pharmacist next frontier. So just starting with a couple of disclaimers, the view expressed in this presentation are my own, and they do not necessarily express those my employer. Also, as a financial disclosure, that I serve at the Health IT Leadership Advisory Panel for Pfizer. And another disclaimer that just the field of AI is expanding rapidly, and what we might provide today as an example might be outdated in a couple of months or years. So just a plug to ensure that we keep continuously adapt, evaluate, and evolve alongside the technology to ensure our patients always receive the care that's safe, ethical, and evidence-based. With that, the objective today, those will guide our discussion today. First, we'll look at some of the terminology and key concepts around artificial intelligence, digital therapeutics, and remote patient monitoring. We'll then look at some of the published literature on our AI impact on patient outcomes and how it's expanding clinical roles. We'll then look at some real-life examples where AI is being applied in ambulatory care pharmacy, in both administrative and clinical tasks. And then we'll finish with analyzing future artificial intelligence applications, some potential risks, and some essential skills for the pharmacist to be prepared. So the term augmented intelligence was used by the AMA to highlight the technology. The technology is here to enhance our capabilities and not to make us obsolete. This mindset is very important in ambulatory care clinics. We're managing patients, and AI can be a powerful ally for us to extend our reach. We're talking about outpatient settings, primary care clinic, specialty clinic, where as pharmacists, we're managing disease, we're managing patient, and the healthcare landscape is changing with digital tools. So it's vital for us to explore how AI and related technologies can bolster pharmacist impact on patient care. So starting with some key concepts, the term artificial intelligence, AI, is used to classify machines that mimic human intelligence and human cognitive functions, like problem solving and learning. AI uses predictions and automation to optimize and solve complex tasks that usually humans have historically done, such as facial recognition, speech recognition, decision-making, and translation. Machine learning is a subset of AI and allows for optimizing. And when it's set up correctly, it helps us make predictions that minimize the error that arise from just guessing. For example, companies like Amazon use machine learning to recommend product to specific customers based on what they have looked at and what they have bought in the past. So the key terms in machine learning are features, which is an input variables and independent variables or input. And the label is the outcome that we're trying to predict in machine learning. So here we take a closer look at different type of machine learning. There's the supervised machine learning, which in this, we're trying to train the model using labeled data, meaning we already know the correct answer. And the model uses that to learn how to make predictions. In the second form, the unsupervised learning, we only give the model raw input data, and the model has to find the patterns or grouping on its own, such as clustering. The third type is the reinforcement learning, which is different. It's a bit different than previous two. It's based on a trial and error. So the model interacts with the environment, learns from the reward and penalties. At the bottom, we see some examples of common tasks like classification, regression, clustering, or dimensionality reduction. And some supervised learning. So the classification one is trying to classify data and categorize the output based on the features. So those are some, and it's a bit technical, but some of the highlight of the different type of machine learning, the supervised, unsupervised, reinforcement learning. And in some model, we use a combination of supervised and unsupervised, so they call it semi-supervised machine learning model. So now let's dig deeper a bit. Neural network are machine learning technique that's inspired by human brain, how the human brain works. They form the foundation of many advanced models, and deep learning is a more complex version. It stacks multiple layers of neural network to automatically extract features from data. Generative AI is a type of deep learning, so it's focused on creating new content like text, images, or audio. And the final one here in the slide we have is the large language model, LLMs. And they are a specific kind of generative AI, and these models are trained to understand and generate human-like language. So you can see how each one of those fields is a subset of the other, and some of the terms are used interchangeably, especially the artificial intelligence and machine learning, but we can see that each one of them is a subset deeper. So what makes generative AI so powerful? Unlike traditional AI, which is focused more on analyzing existing data, modern generative AI can do much more. It can understand, and I will do air quote on understand, massive amount of information and produce coherent, natural sounding language. It can also identify hidden pattern in the data. But what really sets it apart is the ability to generate completely new content from scratch. So that's what's being different, and that's probably what revitalized the field in the last couple of years, is the ability to generate completely new content versus the old tools where it was trying to predict and make prediction. So here we all know, and we've used ChatGPT and other tools, so now we see new images, new paragraph, or even new code being generated by artificial intelligence. So here we outlined the AI ecosystem, and this graph is trying to show us the different technology within this ecosystem and how they vary in terms of maturity and complexity. On the left side, we start with the software capabilities and integration, so which are mature and widely used. These involve automation features that reduce manual effort by connecting systems. Next, we have robotic process automations, or RPA, and these are very rule-based pods. They are designed to handle repetitive tasks like data entry or form processing. In the middle, we see robots, which are physical machines that can carry out tasks either by being programmed or by sensing and responding to their environment. Moving further on the scale, we have the AI and machine learning technologies. And as we talked, those involve algorithms that enhance intelligence and trying to mimic human intelligence. And the lowest on the low maturity side is the generative AI and large language model. And as we've seen, they have come way around, but they're still low on the maturity side based on the other comparison. And they are designed to understand and generate human language. They are the newest portion. It's a fast evolving part of the AI ecosystem, and it's focused on creating new content for the user. So AI, this AI agents and agentic AI, those are two fairly new terms that we hear now. An AI agent is a software system that follows rules or learn patterns and perform tasks automatically. It can respond to input or operate in a specific environment, but does not set goals or adapt beyond what it's being programmed to do. In contrast to that, we have agentic AI, which is more advanced and can set its own goals, break them down into smaller tasks, learn as it goes, and make decisions across different environments and different situations. These systems often have memory, reasoning, and ability to work with other agents. So if you can think about agentic AI is putting multiple AI agents into the same system and being able to work with together. So a pharmacy example to help make this clearer, a basic AI agent would simply flag a high A1C and suggest dose change. But an agentic AI would recognize that diabetes is uncontrolled, review past lab trends, suggest personalized interventions, and even schedule a follow-up, all proactively and without waiting for systemic input. Now, a couple of terms that we need to discuss that are not AI or AI related, but they have been used very closely with AI. So digital therapeutics, which are essentially software used for treatment, as like an example, FDA authorized an app for substance use disorder and that deliver cognitive behavioral therapy exercise for patients. Some of them are prescriptions and some of them are just regular OTC. The key part is that they're not just for wellness app. They go through clinical trials and FDA review as a medical device, and they can help in treating or managing condition, either alongside drugs or sometimes in place of a drug. This is, as we know, this is the new frontier, and it might help as a pharmacist. We might be able to manage not just the patient bills, but also the apps that goes with it. The idea is here that we need to know which digital therapeutics are out there, how they work, and ensure they are used correctly, much like what we do with medication. So it's an opportunity for us to, as a pharmacist, to be involved and improve patient care while using technology alongside us. Another key term that we're just going to review is the remote patient monitoring, which is basically bringing patient daily health data into our view without needing for them to come to the clinic. As a pharmacist, we can catch issues early. For example, if the RPM system shows that the patient blood pressure have crept above the goal, or we can call them and adjust therapy, rather than finding out there in their next scheduled appointment. This continuous monitoring is being enabled by technology like glucose monitoring or Bluetooth-enabled blood pressure cuffs. And many systems will automatically alert healthcare team if something is off. This will enable early intervention. And this is a space where AI and remote patient monitoring can work together and shine, as AI sifts through tons of data in time and then points to the pharmacist that the patient needs attention now. CMS has recognized the place for RPM in their therapy, and they have supported billing for RPM with different codes. With that, having established a foundation understanding of core terms and concepts, we'll now turn our attention to recent research and examples of practical implication of AI, including how they are affecting patient care. So let's talk about some outcomes. Do AI tools outcome actually improve patient care? According to a recent systemic review that was published in The Lancet, the answer is cautiously optimistic. The review did analyze studies up to 2024 and found that in many cases, AI-assisted clinical decision-making led to meaningful benefits. For example, for some interventions, reduced hospital stay, and even lowered mortality rate. This is a significant outcome. Patients receiving AI-supported care, such as tools that help guide discharge timing, treatment choices, often did better than those receiving standard of care. But it's important to be realistic. These tools aren't a magic fix, as we all know, and the benefit varied depending on the clinical context. Most studies were inpatient settings, like ICU, so we have to extrapolate those results to the ambulatory care settings. But potential for AI to help us, and when implemented well, it can improve outcomes and help pay our patients. AI is showing real promise in improving medication safety. In a study at the two major hospitals, Brigham and Women's, and in Mass General, a machine learning tool called MedAware was able to detect prescribing risk that the traditional system missed. In fact, about 68% of this alert weren't picked by existing tools, and 80% were rated as a clinically valid alert. And nearly half of them had a medium or high value. Potential impact here is big, not just safer care, but also cost saving, as we all know, and prevented error savings around $60, adding to up to per error, adding to up to about $1 million over 5 years. A separate review supports this direction, show that how AI and methods like deep learning can personalize drug dosing and catch complex error, especially in high-risk areas like oncology or ICU. Together, these findings trying to highlight that with AI, we're becoming smarter and able to provide better care for our patients and prevent errors. Another example is how AI can make pharmacist intervention smarter. This is a recent study in 2025. It looks about 10,000 outpatient records. Researcher tested a machine learning model to predict which patients were most at risk for hospitalization. Traditionally, they were using the polypharmacy, kind of patient with more than 8 meds as a simple flag, but this, we know that doesn't capture a full picture. And instead, this model incorporated data like medication adherence, prior hospital visits, medication classes, and even zip codes for income estimates. And it identified high-risk patients with 3.5 times better accuracy, boosting the true positive rate from 16% to 56% and reducing false alarm. For pharmacists, that means we can focus more on our time where it matters most, on patients who truly need our support. This is another example of how AI can help us be more proactive and precise in our outpatient care. So another example for patient engagement and adherence, this systemic review looked at how AI tools are being used to improve medication adherence in chronic disease care. It covered 26 studies and found that technology like mobile apps, smartwatches, and chatbots can help patients stick to their treatment plans by providing tailored reminders, adjust their monitoring behaviors, and provide support decision-making. Not only does these tools improve adherence, but they also show clinical and economic benefits. like lowering blood pressure, healthcare savings. AI classifiers were especially useful in helping pharmacists prioritize how and who need help most. Overall, this shows us how AI can be a powerful partner in long-term disease management. Another example in evaluating AI in ambient documentation. So this study evaluated the real-world impact of ambient AI documentation tool among 100 clinicians. After using the system, burnout rate declined from 42% to 35%. And though this change wasn't statistically significant, what was significant were improvement in predictive perceived workload. Clinicians reported lower mental demand, less rushed pace, and less effort to complete notes, all with strong statistical support. So this AI tool helped reduce time spent on documentation and saved more time per appointment. Notably, satisfaction with work improved dramatically among primary care physicians. 86% of primary care clinicians reported improved satisfaction, 36% in the medical specialty, and 50% in the surgical specialties. Again, another example highlighting how ambient AI can meaningfully reduce clinician burden and improve day-to-day experience with care delivery. This is another separate study that was done using evaluating AI-generated patient portal messages. This is a very small subset. They were looking at about 20 primary care physicians that reviewed 18 drafts that was generated by the system. And interestingly enough, there was some messages that had error message, but they were missed and could have posed safety risk. Still, most clinicians agreed that AI reduced their cognitive workload, and 3 out of the 4 found the draft generally safe. This is also highlight the importance of building a strong oversight and training for error detection for the system as we integrate AI into our patient-facing tools. So all those highlighting good evidence about using AI and its improving outcome, but we still need to be cautious. There's this still early days of using AI in real-world healthcare examples. And the systematic review that found under 20 solid studies, we're going to see a lot more research in the next few years. And while more reports are positive, we need to keep an eye out for any downsides, any unintended consequences, or cases where AI does not help. The good news that from those trials, there was no harm or worse outcome that was caused by the AI tool. But sometimes potential harms aren't obvious until you have large-scale use. That's why ongoing evaluation of and publishing results, whether it's good or bad, is important for us. In summary, the evidence so far indicates that AI can help patients, making more care more effective and safe. But as healthcare professionals, we should continue to scrutinize and validate those tools as they become part of the practice. So after looking at some of the published evidence, we'll now try to focus a bit on what are the practical implementation of AI in the ambulatory care setting. Where can AI help us in our day-to-day practice? There is a saying that it's used on different fields, but I will change it a bit and use it for pharmacy. So I would say AI won't replace pharmacists, but as they say, pharmacists who use AI will replace those who don't. And that applies to any field, not just pharmacy. And tools will make us, will mean for us fewer hours doing administrative tasks and paperwork, and more hours running clinics, adjusting therapies, and talking to our patients. So more bandwidth to practice at the top of our license. In automating mundane tasks, documentation can take up valuable time that could better spent on patient care. And AI tools now help us by using ambient voice. And those technologies that I'm going to share, regardless of the current EHR that's being used at your facility, they are either being evaluated, being applied, or used, or developed by the different EHR. I'm trying to keep this presentation as much as vendor agnostic, but I've seen different tools by different EHR vendors being developed, trying to achieve the same result. So hopefully you will see something similar regardless of the EHR that's being used. So now using ambient voice technology to draft visit note based on conversation during encounter. And these tools can help adjust the tone and complexity of documentation, even patient correspondence or patient education materials, making them more concise and easier for patient to understand. AI can also identify opportunities to improve clarity, completeness of the clinical documentation. Auto-generating course summaries and discharge notes is also helpful, especially during transition of care when medication reconciliation is key. Again, many of those tools are already live or being piloted across health systems, depending on the EHR and use. And while they vary, hopefully you will be able to see them very soon if you're not already using them. Another area when automating mundane tasks is pre-visit preparation, which is very important for pharmacists and other healthcare providers, especially when you're managing chronic disease and complex medication regimen. So AI tools currently can summarize recent clinical notes, allowing you to quickly review what happened during the last visit without digging through the full chart. These systems can also generate high-level summaries for prior encounters, highlighting key points relevant to medication therapy and decision. This level of automation streamline workflow and ensure that we're well informed before seeing our patient. Another area also we're seeing work being done is the administrative barriers like prior auth, which often delay therapy and add to the workload. AI can help streamline this by reviewing clinical data, identify what documentation is needed, and even answering common prior auth questions before sending them to the PPMs or insurance. It can also draft denials for appeal letters and improve efficiency and approval rates. AI can suggest clear and standardized instruction to complete refill requests more completely, saving both the pharmacist and prescriber time. One area that's being piloted here also is like drafting those answers to the pre-auth claim, and that hopefully will be a very helpful tool to help us in saving time and getting more prior auth approved. Another area is ambient voice tools that just do not document visits, but they can also queue up orders like labs and medication orders as they're mentioned in the conversation. This will allow healthcare provider involved in the or pharmacists when they are in the collaborative practice agreement to streamline order entry without extra clicks. On the data side, also AI is trying to help turn simple query or simple clinical question into a structured reporting query. For example, asking which of my patients have poor medication adherence or elevated A1C can trigger the system to build full actionable data, empowering us to proactively manage patient outcomes. So you don't have to wait for somebody to help you with report structure. You can just type whatever on your mind and then get the result out of the report. So some expanding how we can use those tools to expand our roles and looking at some real life examples where those tools are being used. At MRA Healthcare, the pharmacist piloted an AI tool called mPharmD to support drug information services across 10 hospitals. The tool used algorithms to generate answers, which are then reviewed by pharmacists to ensure accuracy. In just one quarter, pharmacists submitted over 350 new questions and reviewed nearly 2,700 past responses. They also prepared 10 P&T documents using AI generative monograph template. Overall, this tool translated into saving up to 800 hours of pharmacist time, which is about 2 full-time positions, with cost saving of around 30,000 per month. So that was a lot of time saving and help for our pharmacists using those tools. Now, where did the pharmacist fit in this tool, using this tool? What's unique about it is that this pilot was pharmacy-led from start to finish, and the drug information pharmacist and clinical director ensured the pharmacist guided the tool content and integration. The AI was also trained with feedback using hospital-specific formatting and query. One major insight that they learned from this pilot was that funding remains the biggest hurdle, as we all know. But again, this tool demonstrated return on investment. So using example like this, we can help and be able to convince leadership to adopt tools like this, and then scale them to help us and provide a better service. Another example where at Legacy Health, ambulatory care pharmacist piloted an AI documentation tool. It's integrated directly within the EHR. The goal was to reduce documentation time, improve patient engagement without sacrificing clinical quality. Over the pilot, which was 3 months, the tool showed clear benefit. Documentation time dropped by about 40%. Pharmacists were able to see up 25% more patients, and charting outside work hours was cut by nearly 40%. Importantly, all patients surveyed said they felt more engaged during their visit, and they were happy with that. They were very satisfied to see that. This again shows how a AI tool can help reduce burnout, improve productivity, and patient experience, especially in high-demand settings like the ambulatory care setting. And the pilot was also, where did the pharmacist fit in this pilot? It was pharmacy-led, with clinical pharmacists driving both implementation and feedback. While the AI tool was integrated into Epic, the pharmacists were given flexibility and they could adopt it into their own pace after completing the training. Pharmacist, administrator, and were the key stakeholders, and they played a role in ensuring successful integration. One important lesson they learned that justifying the cost of the AI tool license, especially without clear reimbursement pathway. But again, with doing the right pilot and the right pharmacist, they were able to show results that can help convince and provide the case to convince for more implementation that will help pharmacists be more effective in their care. Another example, another real life case study that was done at Mount Sinai, showing us how AI was used to improve medication safety, especially in elderly patients at risk of hospital delirium. There was a machine learning model that was embedded in the EHR, combining structured data with clinical notes using natural language processing. It generated daily risk scores to identify high-risk patients of delirium. The results were impressive. Delirium detection rates increased fourfold, jumping from 4% to 17.2%. The use of high-risk medication like benzos and antipsychotics were significantly reduced. And this also shows a clear case of how AI can support safe prescriber decision and improve patient outcomes. While this is an inpatient tool, we can extrapolate results and use similar examples in the ambulatory care setting. Now, what was the role of pharmacy and pharmacists in this case? They were central in the development and implementation of the tool. They helped identify high-risk medication, informed the model with pharmacologic risk factors, ensured that it was aligned with real-world practice, and their involvement was essential for the success of the tool. Some of the lessons learned that they needed a cross-team collaboration with different team members to be able to achieve this. And even though that there is a great result, scaling those will need time and alignment to be able to see those beautiful results. The co-design approach supported adoption because the users were involved in the design of the tool. Another administrative type case where the UCSF Health, they used artificial intelligence to automate medication-related fax processing at specialty pharmacy. The AI tool used a combination of computer vision, natural language processing to read those images of those faxes, classify them, rename them, detect duplicates, and streamline tasks that were previously manual and time-consuming. This tool integrated into their existing workflow, and the outcome was really helpful. When the tool was able to review over 19,000 fax and process them in 1 month, and detected a lot of duplicates. It reduced manual workload for the staff. It was a very good use case of automating administrative tasks using AI tools. Again, what was the role of pharmacy and pharmacists? They just didn't adopt the tool. They develop the tool with IT and AI teams. And their feedback was very helpful during the pilot testing to improve the tool. Again, success depends on teamwork with pharmacy technicians dealing with challenges like images pre-processing and PDF to work with PDF type images. This is a great reminder that when pharmacists lead innovation, even systems that like fax, legacy system like fax, can be transformed into smarter workflow and help us in taking care of our patients. Another real-life example using AI-powered tool to support medication review. They used a tool called API Med, which function as a clinical support tool and integrate a stop-start prescribing criteria and present information visually to enhance medication review. It's important to note that this is a rule-based AI engine. So it was not a machine learning, but some sort of rule-based AI engine, which used patient-specific data to flag inappropriate prescribing. In simulated use, pharmacists identified 1.6 times more drug-related problems and proposed better quality intervention without the needing to increase time for review. And the usability score ranked as excellent. So it was very good experience for our pharmacists. Pharmacists were the primary user of this tool. Their involvement was essential, not just for the tool, but for optimizing it and making it relevant to older patients. This case demonstrated how AI tools can enhance performance and also highlight risks, such as automation bias, where users may rely too heavily on alerts. So we need to continuously monitor and evolve those tools to match the guideline updates and support real-world collaboration between providers, healthcare providers, and pharmacists. So all these examples shows how AI in action, improving pharmacy services. We're getting smarter in patient targeting, more precise therapy adjustment, new adherence insights, and early intervention. Those tools will tell us where to look, and also we decide how to act. So the synergy of artificial intelligence and the clinical judgment is what would lead to better outcomes and a stronger workflow and patient care. We'll take a quick break with questions. So if you want to throw it in the chat, the answer, that will be helpful. So a pharmacist using a tool that generates draft patient instruction based on chart data and recent lab results. The tool adapts its responses over time and better match patient comprehension level. Which type of AI is most likely powering this tool? We have supervised machine learning, generative AI with large language model, reinforcement learning, or traditional clinical decision support system. And the correct answer is B, generative AI, because it's generating content in natural language and adapting over time, which allows more with the use of generative AI and LLM. Second question is, based on recent studies, which of the following reflects a validated outcome of AI implementation in clinical practice? AI tools can replace pharmacists for adherence monitoring. Ambient AI systems significantly increase documentation time. Machine learning tools improve medication adherence in chronic disease. And AI system constantly outperform physician in clinical judgment. And the correct answer is C. As presented it, systemic review found that AI tool improved adherence outcome in chronic disease patients. So having evaluated those real-world examples, now let's look at the future a bit and seeing what's the application, what's the risks, and how we can be prepared. There is a lot of increasing the precision pharmacy. So combining pharmacogenomic data with AI could allow us to do individualized therapy selections. AI tools will give us instant insights on patient genetics, disease subtype, lifestyle, and then help us come up with a tailored medication regimen. Being able to use predictive model will get better and help us with predict where we can help, enabling preventative measures, like seeing that this patient has an 85% chance for exacerbation in the next 2 weeks unless we take action. So this will empower pharmacists and provider to intensify treatment proactively. Now, when I was doing this slide about a month ago, I was like looking at examples of in some studies and some literature about like trying to anticipate what's going to come next. And I was thinking, like, maybe we can see a pharmacist having AI copilot during clinical visit, and you just ask the chart, what's the patient A1C in the last 3 months, or summarize any specialist notes, and using that in a chat-based type, so you can just talk to the chart, and then the large language model could reduce those results, and that will help us. That was about a month ago when I did this slide. Well, comes out that earlier this month, this seemed to me like, oh, I'm very forward-looking concept. But since then, it's already become a reality. Stanford Medicine announced a chat EHR, which is an AI tool that allows clinicians to interact with patient medication records using a secure AI-powered chat interface. So it enabled them to ask questions, and then they will just get results. Like you are asking ChatGPT, but you're actually chatting with the patient chart. That's a very powerful tool, and hopefully we'll see a similar tool in the near future being more integrated within the EHR that will help us take care of our patients. Now, digital therapeutics and remote patient monitoring will likely boom. Currently, only a handful are FDA authorized, but more are in the pipeline. And if those become part of standard care, pharmacists will be able to manage those along with drugs, medication, and treatment. And it will be routine to say, like, here's your inhaler, and install this app, which will guide your breathing exercise, for example. And this will help us monitor progress in the dashboard, and then will ensure that the drug and medication is working for patients and adjust as needed. So as we look toward integration, integrating AI into ambulatory pharmacy practice, it's critical to acknowledge that with opportunities comes responsibilities. This diagram highlights 8 major categories of risk that we must be prepared to navigate. First one, we're talking about accuracy and validation. So many AI tools still lack real-world clinical validation. We've seen some, most of them are still in the study type controlled environment. Real-life examples are still very few, and results vary across patient population. So we need to be very vigilant when we're looking at the accuracy and validation of those tools that we'll be using in patient care. Bias and health equity is another pressing concern. AI system trained on incomplete or skewed data can perpetuate disparities. A well-known case was an algorithm underestimating the needs for Black patients due to biased training data. So that's a very area of concern, and we need to be cognizant of what type of data the AI model was trained on, and does it match the patient population that we're trying to use this tool on. We have ethical considerations. So in medical applications, autonomy, beneficence, non-maleficence, and justice. So these go beyond fairness. How do we ensure that AI aligns with patient values and doesn't promote decisions that prioritize cost savings over compassion? So making sure we keep an eye on that is very important while we more and more using those tools in our care. Liability and accountability is a growing challenge. If harm results from an AI recommendation, who is responsible? The clinician, the vendor, both, the health system? We don't have a clear vision about that yet. So current legal frameworks are not yet equipped to fully address that. And at this time, institutions have to address that while we get a legal framework at the national level. The next category is over-reliance and disliking. We're talking about the tendency to trust the AI tool much. And if we stop questioning recommendations or let our clinical judgment erode, we risk errors. And so we need to continue to be vigilant in keeping our clinical judgment in the picture and making sure we're evaluating any recommendation we're getting from those tools. Privacy and security is another high-stake issue. AI often depends on large data sets, and sometimes these data sets are stored in the cloud. Patients may be uncomfortable with that. A strong encryption might not be used. What's the consent being done for patient data to be used? Who owns the data? Is it the vendor, the health system, the patient? So all those need to be clarified. Data ownership policies must be in place before being able to use those tools in practice. Then we face the reality of regulatory and legal lag. AI evolves at a much faster rate than policy, leaving the health systems in the gray zone, and they have to make their own policies and spend time reviewing that because there's a lag on their legal review. And finally, cost of implementation challenges. It's not all institutions have the resources or the infrastructure to deploy and maintain those AI systems. So creating the case for using those, being able to implement those AI tools is very helpful. But still addressing all these challenges thoughtfully and interdisciplinary collaboration, policy development, and ongoing education is essential to building trust and ensure safe and equitable integration into healthcare. Now, I want to show you an example of how AI model can reflect the biases in their training data. So I gave a prompt to the model, and it was very simple. Draw a group of watches showing 3 minutes after 12. And I did ask for ChatGPT. This is the result I got from ChatGPT. Nice looking watches, but not 3 minutes after 12. And then I asked Google Gemini, same example. You can see it's 10:10, all 10:10. Now Google Gemini was trying to be smart, so it's showing me 10:10, but it's writing 12:03. That was impressive. So instead of displaying the classic, those images are showing the classic 10:10 layout, which is commonly used in watch advertisements to create because of the visual symmetry and the ability to see the logo and the brand. So this layout appears frequently in image datasets that these models have learned to default to it, even when you explicitly instruct otherwise. This illustrates a key limitation. Generative AI models do not understand intent. They replicate patterns they have seen. In healthcare, similar limitation can manifest in more serious ways, like default predictions or missed edge cases. There was also a recent AI paper published by Apple under the title The Illusion of Thinking. And they found that large language models demonstrate inefficiencies when they're puzzled by complex puzzles. They tend to overthink and fail to generalize algorithmic reasoning. What Apple wrote in their paper that this reveals a fundamental limitation in current approaches. So these AI tools are powerful when they are used in their place. But this example is a reminder that clinical oversight, context, and verification remain essential, especially in healthcare settings. Like that's a very important, very high-stake environment that we need to be very careful when taking those recommendations and applying them to patients. Another example for what happens when we rely on AI detection tools without context. You might have seen this on social media. An AI detector, I tried it myself, labeled the US Declaration of Independence as 97.7% AI generated. This highlights a major limitation also. These tools aren't designed for historical data or well-polished text because the Declaration of Independence is very polished text. AI thought it was written by AI. So it can reduce misleading results. It's a reminder that while AI can assist in many areas, we need to use critical thinking and human oversight, which is very essential, especially when evaluating content. I also here I want to put a plug defending our students. So those AI detectors are best used as a rough indicator, but they're not the final proof. So if an AI detector say like this text is 90% AI written, that doesn't mean that it's true. Now, finishing up with some risks and challenges of AI in healthcare, this recent New England Journal of Medicine AI study found that people often overtrust AI-generated medical advices, even when it's inaccurate. They looked at 300 participants, both high and low accuracy AI responses were rated as just as trustworthy as doctor notes. This is concerning because it shows that how the presentation alone can influence trust, regardless of the content quality. And it reinforced the urgent need for human oversight, clinical validation, and caution when deploying AI tools in healthcare settings. So how do we prepare for this future? What do we need to do? What do we need to take care of to be able to use those tools and help us in taking care of our patients? One area of focus is data literacy and informatics skills. So we don't need to become data scientists, but we need to be data literate to be able to make sense of the AI output. This includes interpreting performance stats, understanding how data quality impacts results, how to use our EHR effectively. More and more schools, they include those training and courses in their curriculum. But if we try to help learn more, be data literate, we'll be able to better equip to assist and even refine those AI tools in clinical practice. Critical appraisals of AI tools. So to be able to use AI responsibly, we must evaluate those tools with the same critical thinking we use for clinical studies. Is the tool relevant to our patient? Is it being backed by research? Can it really improve outcomes? By asking those questions, we can help select safe and effective tools and remain actively engaged in the performance of those tools over time. Interdisciplinary collaboration. So we often bridge the gap between the clinical teams and the IT teams because we understand how medication works and how the system works. And we must be able to explain patient care needs to some of the IT colleagues and then translate the insights that we get back to our teams. Learning the basic language of AI help ensure that we're not just a user, but informed contributor to the process, and will help in collaborating with teams to be able to validate those tools and implement them effectively in our practice. As AI tool enter our practice, we need to stay informed of the regulations, looking at what's new in the ethical and regulatory space. Our role include ensuring that patient data is used responsibly and that patients are aware when AI is influencing their care. So we can raise important questions around consent, transparency, and ethical deployment. And we should ask that, and if patients want to opt out, we should help them in that. That's their decision. Finally, adaptability and continuous learning. So technology evolves fast, and pharmacists must be ready to evolve with it. This means staying open to new tools, learning by doing, bouncing back from trial and errors. We might use and do some pilots and be not successful, which is fine. Setbacks are normal, but resilience is key. And importantly, our human strength, compassion, patient connections, communication, those will continue to define us in this augmented future and help us taking care of our patients. I want to finish up with this example. So this is a tool that was called the multiplane camera. And this is the first multiplane camera was invented in 1933. It was last used in 1989, and they became obsolete with the rise of digital animation and computer animation. So those tools, because new tools came, those old tools went away, but we were able to use newer technology to produce better scenes, higher graphics that looks much better. And this is what we need to, I think about, that our roles will be transformed and we'll be able, as healthcare, embrace AI and emerging technologies, not as a threat, but as an opportunity to rethink how to work, how to improve outcomes, how to improve workflows, and how to deliver care more effectively to our patients. So I want to share with you guys a couple of resources that might be helpful for you to look at. The first one is an article called Artificial Intelligence in Outpatient Primary Care. This is a scoping review for application, challenges, and future directions. It's a very helpful article discussing how AI is being developed and applied in outpatient primary care. And most interventions, they're still experimental, but they need integration with real-world clinical practice. But this was a good article to review and read. Another tool I want to share with you guys is the AI Toolkit for Pharmacy Practice by the International Pharmaceutical Federation. It's a toolkit to support pharmacists when integrating AI into their daily practice. Has been launched very recently, about 2 months ago, and it's a very helpful tool to review and see what's in it. Another article, which is AI education for clinicians. So this paper proposed a structured framework to guide how clinicians should be educated in AI to ensure safe and effective use in healthcare. A very helpful article as well. Another article is AI in the health sector, a systemic review for key skills for future health professionals. So this discussing key areas were identified for developing competency, AI fundamental knowledge, data analytical skills, and ethical and legal considerations. So this is what we also discussed, but this will go into more details into this. Also, another recent article from BMJ Medicine, How to Read paper involving AI. This is, I think, a very important article as we see more and more literature being published about AI tools, how it's being validated. This will help us provide at least the understanding, foundational understanding, how to look at those studies and how to interact with them. And then another tool that I'm not sure if you guys are aware of, some of you might be, is Open Evidence website, which is a tool, a large language model specifically trained for medicine with the aim to aggregate, sanitize, and visualize clinically relevant evidence in understandable, accessible formats that can be used to make more evidence-based decisions and improve patient outcomes. This tool is available for free for any healthcare professional in the United States, so you can sign up for it. I think it requires an NBI, but then you can ask and get questions with reference, and it's very helpful for daily practice. With that, I believe those are the reference that I used, and I know we have a couple of minutes, so I will finish up with the third and fourth question. So again, if you can type the answer in the chat, which of the following best illustrate how AI automate mundane administrative tasks in ambulatory pharmacy practice? So an AI system pre-filling prior auth letter and routing them based on prior requirements. AI model that design new drug molecule for Alzheimer's disease. Pharmacist reviewing journal article recommended by chatbot, or pharmacy student summarizing a patient chart manually before visit. And the correct answer here is A. The AI systems can help us with pre-filling those answers, letters, and route them to payers. And the last question is, a pharmacist wants to access the reliability of a new AI tool integrated into their EHR. Which approach demonstrates appropriate preparedness for AI use? Using the tool only if it was mentioned in medical conference, relying on vendors' promotional materials, delegating all evaluation of AI tool to the IT department, asking whether the tool was validated in similar patient population and has peer-reviewed evidence. As I can see in the chat, yes, the correct answer is D. Thank you, guys. With that, I'll open it up for any questions. I will put on the slide here for the continuing education, how to process the CE information. But please, if you guys have any questions, please let me know. More than happy to help to answer.
Thank you so much for your presentation, Dr. Murad. Just a reminder for everyone, if you have any questions, please go ahead and type them in the chat now.
Thank you, Kelly.
While we wait, I just wanted to thank you, Dr. Murad, for this timely presentation on AI. It's going to be interesting to see how AI will continue to evolve and how our profession and our practice will evolve with it. I also reflect on how this will be taught in universities for students that will not know a world without it. So lots to digest there. A great topic to discuss at the Ambulatory Care Forum Social for those of you going to FSHP annual meeting. We'd love to hear from pharmacists how AI is changing their work and share experiences and how you're incorporating it into your practice.
Dr. Murad, we do have a question in the chat. Kimberly is asking, how did you educate yourself on AI? Do you have any recommendations that pharmacists could use to grow their knowledge on the subject?
Yes, and so I would say that a lot of free content is outside, is available. OpenAI, Microsoft, IBM, they all have, and Google have free content on learning the basic of AI, how does it function, some of the key concepts that we need to learn when we're interacting with those tools. I'll also say that ASHP has, I'll put a plug for ASHP, I'm an active member there. They have a resource for AI, and like they're publishing key use cases and content to educate pharmacists and pharmacy technicians about AI and how it's being used in day-to-day activity. There's a lot of content out there. There's volume overload of data outside, and in similar fashion in literature being published about AI, it's tremendous, huge, being done every day. So I know it's kind of a little bit hard to start, but once you at least get to know the concepts, that will help you move forward in how to apply it in healthcare and where to get more information. I hope that was a helpful answer.
Thank you. It was very insightful. I know we're over time, but there's one last question. What AI tool have you found useful and credible for pharmacists? I know you mentioned some already, like OpenAI. Not sure if you have any others.
Yeah, OpenAI is very helpful, and I think that using I guess the helpful tools are the integrated into clinical practice. So if the EHR is offering any tool like that is very helpful usually, even for administrative tasks, as we talked about documentation or ordering. They can be a time saver. So those are very useful. And then the article and the OpenAI that I shared at the end. Trying to be a bit vendor agnostic. So I apologize if I'm not providing a very clear answer.
Thank you so much. And thank you everyone for joining us.
Thank you, everyone. Have a great evening. Thank you, Kelly.
Thank you, Claudia.
Thank you, guys.
Thank you, Dr. Murad.
Thanks for having me.